November is Lung Cancer Awareness Month, and it is the perfect time to remind the Northland about early detection and screenings. And here with us to share more is Dr. Eric Swanson, who is a pulmonologist with Essentia Health. Dr. Swanson, appreciate you being here. Let's talk about what's happening in our region. What are you seeing in terms of lung cancer cases or those related statistics?
Yeah, lung cancer is on the rise across the United States. It's the #1 killing cancer throughout the United States. It has more deaths than breast cancer, colon cancer, and prostate cancer combined.
What does that due to? Is that due to smoking? Is it air quality? What do you think it is?
Yeah, the #1 reason for it is smoking related, but about 20% of all lung cancer is in non-smokers. So it's not all smoking related. There's some genetic predispositions as well, and many other things that you might inhale or be carcinogenic.
Sure. And then Dr. Swanson, what early warning signs should people out there watch for? Are there symptoms that often get ignored by folks out there?
Yeah, symptoms are tough because with lung cancer, it's often referred to as a silent killer, meaning that it's something that you don't develop symptoms until it's a late stage disease. There are a few symptoms that will occasionally show up. Sometimes people will end up coughing up some blood. Sometimes people will notice that they're having a wheeze or a change in their voice. With things like that, that's something that is important to go get seen and make sure that we're not missing something.
And then when it comes to the folks who are getting treated, what are maybe some of the biggest advancements that you're using right now in terms of lung cancer treatment?
Yeah, so there's a number of different things for diagnostics, as well as we've actually been using a lot of artificial intelligence trying to find lung cancer at its earliest stages. So with regards to diagnosis, there's new platforms out there called robotic-assisted bronchoscopy, which allow us to reach deeper into the lungs with a more stable platform and reach, the farthest edges of the lungs so that we can biopsy nodules that historically we weren't able to reach out to get a tissue diagnosis. So we would either be forced to let them grow so that we could then get a diagnosis, or empirically treat people without a known tissue diagnosis. I think the biggest thing that we've noticed is that we have grown a lung nodule program here. And so our group of navigators will actually run the lung cancer screening program and the incidental lung nodule program. And that incidental program finds a lot of nodules that may have been done on a CT scan of your neck or of your abdomen when you were in the ER for something else. And historically, those wouldn't be recognized or tracked. And this group of nurse navigators will end up finding all of those nodules, getting the patients in to see their primary docs and potentially specialty care so that we can find lung cancer at its early stage rather than finding it a few years later.
It's super important. And for our viewers out there, you can find more help at essentiahealth.org. Dr. Eric Swanson, appreciate your time today, sir.
All right. Thanks very much.